Okay, Tambash, our topic today is about sports injuries evaluation. All right. The assessment of each injury is divided into two categories, the primary assessment and the secondary assessment. The primary assessment actually deals with the injuries that are life-threatening or injuries involving airway, breathing, and circulation. So we do just a primary assessment of the situation. The secondary assessment actually done when we are dealing with non-life-threatening injuries. Luckily, luckily, most athletic injuries are not life-threatening. The primary assessment is done in the following order. So we have an accident or we have an injury. So how we deal with them? We are dealing with them in this order. The first, we have to check the scene for the safety. What does that mean? It means that the whole scene, there may be an accident in that whole scene. So the first thing you have to check whether that scene or that place is safe for you to get involved. Maybe if they're in a situation of fire, it means that the fire is pushed off, all right? If it's in the state of a stadium or of a play, you make sure that before entering into this field, you better check that the play has been stopped to not get hit by a player. So the first thing is just check the scene for safety. Second, assess responsiveness. While you reach to the player, you have to assess responsiveness by lightly tapping. Tapping the كده or shaking very gently and talking to the athlete. So you must check whether the athlete or the player is responding to that or not. So if there's lack of responsiveness, like no breathing or abnormal breathing indicates a cardiac emergency. Okay, so if the player is not responding to this gentle tapping or to small talk, so you have to declare a state of emergency. Immediately you have to call, actually 911, that's in America, in Kurdistan, it is 122, all right, 122. You have to call 122 and obtain a defibrillator if available. Immediately, you have to start CPR by initiating chest compression. So you have to put the player on his back and starting chest compression. That's actually after checking the airway. There's nothing obstructing the airway. And after checking that, so you have to put on his back and starting chest compression. And then you have to open the mouth and provide 2 breaths. Okay, that's CPR. And at the same time, you have to check for severe bleeding. And the sequence for that actually is 30 chest compression and 2 mouth breathing. And the 30 compression should be finished within 18 seconds. Okay, you have to do chest compression within 18 seconds. Okay, checking the scene. As we said, before anything, you have to make sure that the scene is safe. So the first step is to prevent any more injuries that already exist, which includes making sure you do not get hurt, right? So you must take care about yourself also. If the scene is not safe, you must not get involved. Approach an athlete only when the scene appears safe. If, for example, an athlete is going down during a football play, you will need to make sure that the play has stopped so you do not step onto the field and accidentally get hit by another player or by a player, all right? After you reach the player, you have to determine, as we said, the responsiveness. So the first step is to determine whether an athlete is conscious and able to respond. An unconscious athlete may be able to hear and may be able to respond to a voice if she does not have a severe head injury. The response may be no more than a squeeze of hand, but even such a feeble sign is an indication that an athlete is hearing and reacting. So the patient is an unconscious, okay? But she or he may respond to gentle tapping or to a talk in case if she does not have a severe head injury. No one near the athlete should speak negatively about the athlete when she's unconscious because she may able or he may able to hear. That's very, very important. And you know, reasons for unconsciousness includes poisoning, respiratory arrest, cardiac arrest, hemorrhage, diabetic illness, heat-related illness, cold-related illness, and head injury. So if you have an unconscious player in a field, you must think about these things. Could be poisoning, or could be respiratory arrest, could be cardiac arrest, or could be hemorrhage, diabetic illness, health-related illness, cold-related illness, and head injury. So if an athlete is able to react clearly and logically to the responsiveness check, you will know that the airway, breathing, and circulation are okay. So if the patient able to talk to you or respond to you, so you'll be happy that the athlete or the player is okay. I mean, not okay, he's okay in terms of airway, breathing, and circulation. So at that point, the primary assessment, you can skip the circulation, airway, breathing steps and proceed to check for severe bleeding. It's important to recognize that if athlete does not respond, however, you must check for circulation, airway, breathing. If other rescuers are present, they should be directed to call 911. Okay, and as we said in previously. So how we should start the sequence? If the respiratory or circulation system is impaired, the athlete's life is in danger, and you must respond quickly to give the athlete the best chance for survival. As we said, quick action and early chest compression without interruptions are recommended. That's a diagram for that. So as we said, the first thing is we have to check for the safety of the scene. The second thing, we have to check for unresponsiveness. If the patient is not responding and not breathing, so you have to call 911. Actually, that's in Britain. So you have to call 122 and ask for ambulance. Start immediately 30 compression on the chest, followed by 2 rescue breaths. That's we have to continue this CPR in a form of 30 to 2. So as soon as the defibrillator arrives, you have to follow the instructions on defibrillator and use it. All we talked about was the primary assessment for both responsive and unresponsive players or patients. Now we are talking about secondary assessment. Secondary assessment includes focused history and physical examination. Thus, they should be done after initial or primary assessment. It's assumed that the life-threatening conditions have been found and corrected. If you have a patient with a life-threatening problem that requires intervention, you may not get into this component. That's the secondary assessment. Actually, you need a good time and a relaxed situation to get enough physical history and examination of the patient. The main purpose of focused history and physical examination, i.e. of secondary assessment, is to discover and care for patients' specific injuries or medical problems. So acronym to obtain a patient's history, that's very, very important. You have to ask about these signs and symptoms. If the patient is complaining of anything, or if you can see anything, you have to ask about the history of allergy, because the players might got allergy reaction to something. So you have to ask about whether he or she has a history of allergy to any product or food or drugs. So you have to ask about any medication. Again, that could be in a situation of side effects of that medication. Pertinent past medical history, if the patient has diabetes mellitus or hypertension, cardiac disease. Okay. Last oral intake, again, is very important, that because we have to ask about the last oral intake, because she might got some kind of food poisoning. Or it's important to know if there's a special food in his stomach, because he may get vomit, and when he get unconscious, that could raise the risk of aspiration pneumonia. Again, events leading to the illness or injury. So what happened? Tell us, maybe you were not there. So you have to ask about what happened. So the acronym is that sample. Please sample. S for signs and symptoms, A for allergy, M for medications. P for past medical history, L for last oral intake, E for events leading to the illness or injury. So the rapid assessment, as we said, rapid assessment is important from head to toe assessment. That's very quick procedure. Then focused assessment on the specific injury site or medical problem. Maybe he may go, for example, he got injury to the knee. So you have to do focused assessment on that knee, all right? You have to check for vital signs, as you know, includes pulse, respiration, skin signs, pupils, blood pressure. Okay, you have to all document all these things, plus documenting oxygen saturation level, SpO2. Again, we have to check for the pulse, respiration, includes rate, depth, sound, and ease of breathing. For the skin signs, like color for the skin, temperature, moisture, are important things, you know. Pupil size, equality, reaction to lights, constricted pupil in a mass casualty events are highly suggestive of nerve poisoning, organophosphate toxicity. Okay, so we have a time to deal with the patient. So after we took history, then we go to, as we said, physical examinations. That's how we do head to toe examination of a trauma patient. In the head, you are looking for all these things, for any wounds in the scalp, deformities in the skull. You have to examine the eye, and if there's any impaled objects in the eye, determine pupil size, equality, reactions to light. Again, note the color of inner surface of the eyelid. Look for the blood, clear fluid, or bloody fluids in the nose and ears. Examine the mouth for any obstructions, blood, and any odd odors. Again, for the chest, you have to expose the chest. You have to look. That's a focused physical examination on each part. If there's any cuts, bruise, penetration, impaled objects, any fractures, or no chest movements, okay? We are looking for the equal expansion of both sides of the chest. In the abdomen, again, we are looking for the same subjects, same things. Again, you have to look for the tenderness, and it's important actually to determine if the patient has tenderness. And again, you have to check the site of the tenderness, the quadrant, because each quadrant is indicating certain problem. The lower back, you have to cuts, bruise, penetrations, impaled objects, again, tenderness, deformity, and other signs of injury. Pelvis, feel pelvis for injuries and possible fractures. Again, after checking the lower back, slide your hands from the small of the back to the lateral wings of the pelvis. You have to feel them for tenderness, for any movement, for any deformity. Genital regions is important for looking whether the patient is wet or not, because the wet patient may indicate incontinence or bleeding or impaled objects. In male patient, check for priapism, because this may indicate a spinal injury. Lower extremities, again, we are looking for deformities, swelling, bleeding, discolorations, bone protrusions, and obvious fractures. Check for distal pulse, like posterior tibial pulse. If the patient is wearing boots, this is important. If the patient is wearing boots or special shoes or any shoes and has indication of crush injury, do not remove the shoes. Again, check for motor function and sensation. Upper limb, we are dealing with the same thing. We are looking for the same thing. Again, for radial pulse. In children, check for capillary feel as well. Check for motor function and strength. Rapid physical examination for unresponsive medical patient. The other thing was trauma patient. Now we have unresponsive medical patient. It's almost the same as the rapid trauma assessment of a trauma patient with significant mechanical injury. We will rapidly assess the patient's head, neck, chest, abdomen, pelvis, extremities, and exterior. Focus physical examination for responsive medical patient. Again, the philosophy of responsive medical patient is usually brief because he's responding. The most important information is obtained through the patient's history and the taking of vital signs. Again, you have to do focused exam on the body part that the patient has a complaint. For example, the patient has a medical problem. He's telling you that he got a severe abdominal pain. Okay, that's a medical emergency in the stadium. So you have to take good history and you have to do a good physical examination. Okay, I hope that was a useful subject, and if you have any questions, you always are free to ask me, all right, through my email or through my mobile number, or can see me and visit me if you have any questions for any clarifications. Thank you very much. I hope you're the best.